Okay, so let's round off this series with considerations for pregnancy exercise during the final trimester. Um, Now, the major factors that are going to come into play during this trimester are the same as with the other trimesters, just at a different kind of magnitude now, are the belly, having those muscles stretched out, and having that much weight in front of you, um, weight gain, fatigue, and aches and pains are likely to start appearing if they haven't already during this trimester. And all of this is going to really affect the way that you exercise, and what you're able to do, and what you feel comfortable doing, um, and what you feel good doing as well. Most women by this stage will have put on a significant amount of weight, somewhere between 10 and 15 kilos in the final somewhere in the final trimester, and that's pretty significant. And it's all a lot of it is being carried out in front of us, and it does make a lot of things really cumbersome. The belly gets in the way. It's a lot harder to do a lot of exercises, or just a lot of movement. Really, it's hard to get up out of bed, let alone do anything really strenuous in exercise. You are carrying around extra weight, which is a lot more for your hips, for your knees, for your lower back, and it's a lot more weight for your pelvic floor to be dealing with. So we really need to take that into consideration. You may need to really reel back on anything that involves you being on your feet for long periods of time. You may not be able to walk very much. You may find that, especially towards the end, just going around a shopping mall for an hour or two is really exhausting, and you get hip pain, and that's fine. It's okay to feel like that, and you're allowed to feel like that. We really need to switch gears in this final trimester if we haven't. Hopefully we've been working our way down the gears throughout pregnancy, but if we haven't, there is a point where you really need to switch gears in the final trimester. The focus is on other things. You've done the hard work to keep fit during your pregnancy, and now you just need to allow yourself a little bit more rest, if that's what you feel like you need. Anything that causes any aches and pains, we want to reel back on. I personally found it really hard to stop going for long walks, or spending lots of time on my feet, but I had to give into it at some point, and just let myself sit and lie down more. We want to do things that get us out of upright positions as well. So, things like yoga are really great if you're not doing them already. They get you on your hands and knees and change position so that all of that weight isn't on your pelvic floor all the time, and on your hips all the time. This might be a time to start thinking about shorter workouts. It's really normal to experience a lot of fatigue in your final trimester, and it's really frustrating after you've had this great second trimester. If you have had a great trimester and you felt like you've had a lot of energy, it can be really hard to then feel fatigued again. But a lot of women feel really wiped out from their usual workouts when they get to the final trimester. So if you're working out for an hour, you might want to think about cutting down to 40 minutes, or 30 minutes, or 20 minutes, or whatever it is that makes you feel good. For the most part, throughout this series, I've talked about changing your exercise program more in magnitude and not necessarily in kind. So So maybe you've continued doing CrossFit, or you're doing your strength training during your first and second trimester, or your Zumba class, or your spinning class, or whatever it is. But now that you're in your final trimester, this might be the time to start thinking about changing your workouts in kind as well as in magnitude. If you feel like you just can't keep up with your current training program, and that's okay. Some women will manage to do much more, and some women will manage to do much less. But it's better to do something small, 10 minutes of yoga, than to not do anything at all. If you can't do your hour-long CrossFit class anymore, you've got to go at your own pace and not compare yourself to other people. So this might be a time to start to switch to yoga and swimming instead of whatever else it was that you were doing. And this is also a time when in our workouts we should really be preparing for birth. Even if we're not, if you're a coach and you train pregnant women, you don't have to be a doula or be a midwife. You don't have to specialize in that stuff, but there are some really simple things you can do. And if you're in your final trimester as well, like, you don't have to specialize in this, but you can double up your workouts with birth prep, and they're really effective workouts for this final trimester. So maybe you don't need to be doing any more weight training. I certainly found that in the second half of my final trimester, any sort of strength training just completely wiped me out. Even if I just did 10 minutes of it, it was really unenjoyable. So I just stopped. And lots of women stop this kind of training at this stage, and I think that's actually a really good thing. Just letting the body rest and letting the body recover a bit more. So what sort of things can we do birth prep wise, and double up in our training sessions to kind of have more effective to kind of kill two birds with one stone and use that time to be doing some kind of like physical birth prep. We can work on mobility. Hopefully we've maintained some mobility throughout our pregnancy, things like thoracic mobility, shoulder mobility with overhead, stretching overhead, squat mobility, hip mobility. We want to stretch out the posterior chain, and the hip flexors. We just want to do some twists in the spine. We just want to keep the body as mobile as possible. And a lot of this helps get the baby into a better position, which is part of a concept called optimal fetal positioning that most of us come across when we talk about when we're getting ready for birth. And Spinning Babies just talks about it in a really interesting way. So optimal fetal positioning is about getting the baby in a good position for birth, and it, on the one hand, will involve those movements, those gentle movements, like their hip movements and that gentle mobility that will help the baby kind of get into a good position. It may also involve things like inversions, if the baby's breech or in a back labor position and it needs to be flipped around. Spending some time in inversion, so if you're doing things like headstands, they can actually be really beneficial still at this stage, or downward facing dog, or anything where the head is lower than the bum. It can, if you think the baby's always pressing down on the bottom of the uterus, and so if it's in a bad position, let's say it's breech, for example, it's always like gravity's always pulling it down towards the bottom. So if we get the bum higher than the head, and check out Spinning Babies for some examples of this, the gravity will pull the baby down or up towards the diaphragm, towards the head, and it's got a chance to move around and get into a better position. So it can be really good for flipping a breech baby, or a baby that's getting it to turn in the uterus. That might be one element of optimal fetal positioning, and another element of optimal fetal positioning might be just spending more time in a kind of belly facing down position. So not planks. We want the tummy relaxed because it creates more space for the baby to move around. And all fours positions are really great for that. So, you know, there's a lot of things you can do on all fours. You can be doing your cat-cows, you can be doing some glute exercises like fire hydrants and things like that. Bird dogs even are fine. But just spending some time wiggling around is great. A forward bend, like with, say, a fit ball under your hands, that is going to allow you to have sort of a straight back and straight legs. It gets you in that similar the torso is in a similar position to when you're on all fours. And another great example is swimming, where you're doing breaststroke or the overarm stroke. I can't remember what it's called. The belly's facing down and it's relaxed. And this gives the baby a chance to move and gravity to allow the baby's back to sit in the mum's tummy like in a hammock, which is a great position for birth. So these are things that we want to take into consideration. If you spend 20-30 minutes swimming, that could be getting the baby into a great position, even if it's just a really gentle swim and you're not really working that hard. That's okay. You're still killing two birds with one stone. And likewise, if you're doing yoga and you're doing mobility and you're doing some twists and you're moving your hips around, prenatal classes are great for this. You know, that wiggling of the hips also just helps the baby get into a better position in the pelvis and helps loosen things up, helps loosen up ligaments and things like that around the pelvis and around the hips. It's also a time where you might want to incorporate more relaxation into your exercises. So yoga again is great for this, or just doing meditation instead of exercising, taking time out of your exercise routine to do things that just really relax the nervous system and allow you to get into a state of relaxation. Things like hypnobirthing are great because they provide relaxation tracks that help you get into a good headspace, into a nice relaxed state of mind, and prepare for the birth. And finally, anything that involves pelvic floor release, which may involve some types of exercise like the hip movements, like the mobilities, that are going to all contribute to towards that kind of pelvic floor release. But also you may be doing some more manual stuff, like perineal massage and things like that. But that's a little bit out of the realms of exercise guidelines. But I do just want to make the point that exercise might not be the priority. I know that sounds like blasphemy coming from a trainer, but it really might not be the priority during this final trimester, or especially in the last month of the trimester. You might be much better off spending time listening to your hypnobirthing tracks, or doing a meditation, and doing some pelvic floor releasing. And these things might be far more beneficial for you than going to a Zumba class or going to a CrossFit gym, and things like that. So some of the more, you might have noticed my tones kind of changed from the other two videos. In the other two videos, I was talking about, not changing our workouts too much, and not necessarily changing the types of workouts that we're doing, but trying to do as much as we can, or much as we feel confident and comfortable with. This final trimester is a totally different time of life. It's really a time when big changes start happening in the body, and where the woman starts feeling very different, and she has a lot of preparing to do mentally, psychologically, to get ready for becoming a mother and having a baby, and preparing her mind and her body for birth, and rest and relaxation is super important at this stage, and I would encourage you to do that over exercise. It's going to be different for every woman. We obviously see videos and pictures of women who are still lifting really heavy weights or squatting really heavy before giving birth. I have no idea how they're doing that, because I'm so far from that experience myself. I have to assume that it is possible, and if you're feeling amazing and you're still feeling really good doing all of those things, then it's very difficult to argue that that isn't a good thing for you to be doing. But if you're not feeling that way and you're feeling a bit crap about yourself because you're not doing everything that you feel like you should, just relax. You're in good company. 95%, if not more, women feel this way and just need to take it easier through their final trimester. So just start switching gears, focus on you and your baby and preparing for birth, and for becoming a mother, and listen to your body and enjoy this time. I hope that was helpful. I hope that entire series has kind of broken up the different stages of pregnancy, the different changes that take place during pregnancy, and given you a bit of an overview into of how you can change your exercise routine throughout pregnancy, how it might look different throughout pregnancy, rather than kind of just giving these black and white guidelines of do this, don't do that. So let me know if you have any questions. As always, subscribe to my channel if you want to see more content like this. And yeah, let me know if you have any questions. Thanks for watching.